Okay, so without wasting too much time, I'm going to talk about congestive heart failure, uh, trying to know the symptoms, stages, and management. But remember one thing, I am giving this talk so that people understand how congestive heart failure at times starts, so that when you have these vague symptoms come and go, you can at least know what to ask your doctor and when to go to your doctor. I will not be talking about any medications. That is between you and your doctor if you have congestive heart failure. Congestive heart failure has 4 stages. I am more inclined to discuss with you the first 2 stages, where something can be done so that you can stop the progression. Once you get into the 3 and especially the stage 4, then you are in the hands of people who will be putting medications and where your ejection fraction, which we'll talk about, is very low. Now, let me start off by an actual case study. This is true, a true study. Let's call this patient Linda. Now, she is living in the West Coast. It was Linda's dream of driving to the cliffs and by the ocean on the Pacific Coast Highway for as long as she could remember. But she noticed something was off. When normal everyday activities like walking up a flight of stairs at her apartment left her feeling short of breath. Her boyfriend then pointed out that she was panting, but she thought it was just because she had not been working out and was out of shape. But when she felt lightheaded at a music festival and eventually collapsed, she found herself at the emergency room where she learned the cause was heart failure. She was 41. She had not expected her heart to fail. Now, what they found in the emergency room was a very high blood pressure. And an echocardiogram showed her ejection fraction, which is a measure of how much blood the heart is pumping, was only 16%. The normal is 50 to 70. We will talk about this, but just bear in mind, the symptoms were there all along. But she didn't know enough to take action. And this is a true story. She did go to her doctors, got onto a diet, and thereby reduced her salt and got better. But this is our opening case study. When I end it up, I will give you another case study, which is very interesting. So we go on to understanding this. What is this? If you want to understand congestive heart failure, you got to understand the heart. Now, all this while, I've been talking about coronary artery disease, how the coronaries get obstructed and blocked, and the blockages. We are not going there today. What we are doing is the inside of the heart. See, it has got 4 chambers, the upper chambers and the lower chambers. Now, they are divided, the upper and the lower chambers both are divided so that you have right-sided upper and lower and the left-sided upper and lower. The upper chambers are called atriums, the right atrium and the left atrium. And the lower ones are called right ventricle and the left ventricle. And this is separated by a septum. You don't have to remember the names, but remember that there are 4 chambers and blood moves when the blood is coming from the body. The impure, the deoxygenated blood used up by the tissues and the organs, it comes over to the right atrium, the right upper chamber, goes to the right lower chamber, and from the lower chamber, it goes to the lungs to be purified, oxygenated. Now, this oxygenated blood comes back into your left upper chamber, goes to the left lower chamber, and then through the aorta, the good oxygenated blood goes to different parts of your organs and your tissues. Now, bear in mind that going from the right upper to the lower, there are valves. I'm not going to name these valves, but these are valves which open to let the blood go into the lower chamber. Even here on the left side, where the pink, it's good blood, it is a valve which opens. And then from here, in the right lower side, the impure blood is taken by another blood vessel to the lungs. And from here, the good blood is taken by the aorta to different parts of the body. You try to figure this out and keep it in your mind. These are the 4 chambers. Now, if we go on to the overview of this, the types of congestive heart failure is your left-sided failure, this failure, or it could be your right-sided failure. Most important cause of your left-sided failure is your right-sided failure, and we'll explain. Now, how common is congestive heart failure? 6 million people in the US have congestive heart failure. It is a leading cause of hospitalizations in people older than 65. Let me explain. See, your heart is not failed. Your heart is still working, but having trouble pumping enough blood, enough oxygenated blood throughout the body. Think of it as a car engine that's losing power. While it can still make it up a hill, it probably can't tow a trailer behind it. Or think of it as a shipping department that can't keep up with getting all the shipments where they need to go. So there is a backlog. And once things pile up, that is an issue. Because the heart cannot handle the amount of blood it should, like in the shipping department, blood builds up in other parts of your body, and most of the time it collects into your lungs, your legs, and your feet, which we call edema, or the swelling of these lungs and feet, which is there. Now, what happens in trying to push the blood out? The heart enlarges. This is a normal heart, while this is your enlarged heart. Because now it has got a burden. Now it has to function. And there are different types of failure which we'll talk about. So far, okay, so we go on to symptoms. Symptoms can range from mild to moderate to severe. And these symptoms may go and come. Okay, so here we are with the left symptoms of heart failure. Now, shortness of breath with everyday activities like walking across a parking lot, or putting away your groceries, or the lady who is climbing the steps up her apartment, this will cause shortness of breath. You may get chest pain. So you have to rule out things. You get heart palpitations. Why? Because now your heart is trying very hard to pump blood out. So that can create problems with the electrical conduction, and therefore you can get arrhythmias and palpitation. You will get fatigue because your important organs are not getting enough blood. And then, of course, the swelling, which we talked about, will get a weight gain. You may get a chronic dry hacking cough. As I said before, left-sided heart failure is the most common cause of right-sided failure. Get that picture that I put it right in the beginning. When your left ventricle isn't working correctly, what happens? It allows blood to back up. Think about that picture. At some point, this backup affects your right ventricle. And that is how you get the edema and the swelling in your feet and legs. So, what are the causes? See, remember one thing, heart failure happens when your heart muscle gets weak or stiff. Common causes are coronary artery disease or a heart attack. See, so many times you get patients who get a massive heart attack and a part of the heart muscle is lost. Then they are in failure, heart failure, or it can be congestive heart failure. It depends on how massive the heart attack is. But some people can get a heart attack without any effect on their heart's functioning. So this is a common cause, your coronary artery and your heart attacks. Then number two is your cardiomyopathy, which is genetic or viral. And I will go through this so that you understand a little better. Heart disease present at birth, congenital heart disease, all those valves which I did not mention, the mitral valve and the aortic valve, they can have problems in the congenital heart disease. It can happen in adults too. The fact is the blood that is taken from the left lower chamber to the different parts of the body through the aorta goes to the aortic valve. And that happens a lot about aortic stenosis, where the valve gets narrowed down, or regurgitation when it cannot close properly. But don't get into it that right now. So you can get diabetes. Again, the same thing that can lead on to your coronary artery disease. But the very important thing is your high blood pressure, hypertension. What is high blood pressure? It's a force of blood pushing against the arterial wall. So if your arterial wall is thickened, your blood pressure, your heart has to push more. 40% of people in the US have high blood pressure, and this is an underestimate because some of the people are walking around without realizing that they've got high blood pressure because it is a silent killer. And that is one of the most common causes I've seen of heart failure, with starting with hypertension. So get a machine, check your blood pressure, go around to the fire department or your clinic and get your blood pressure checked properly, or at home. You can get arrhythmia. Arrhythmias can cause, if you got some conduction defect and your heart is beating erratically, you can get congestive heart failure. Now, what is, you can get, your causes can be your kidney disease, your obesity, when your BMI is more than 30, your tobacco and recreational drug usage. I mean, all this amphetamine and cocaine and all that can cause alcohol use, that can cause the alcoholic cardiomyopathy. That's a separate issue, but you can get it. And cancer drugs, chemotherapy can cause your heart to be in failure. So let me go over to cardiomyopathy. All right. Cardiomyopathy can lead to heart failure. What does it mean? It refers to diseases of the heart muscle that makes heart muscle, remember, makes it harder for the heart to pump blood to the rest of the body. It can be hypertrophic cardiomyopathy, where the heart muscles thicken. And the causes are genetic, you can be, high blood pressure, and that aorta valve I was talking about, aortic stenosis, it causes back pressure. And extreme athletic training can also cause your heart to become enlarged and your muscles to thicken. Now, what is it characterized by? Thickening of the muscle wall of your left ventricle, the, the left lower chamber. Now, it becomes abnormally thick, and this thickness can affect the blood flow out of the ventricle to the different parts of the body. Now, second is a dilated cardiomyopathy. Here, you do not have the muscles thicken. This, your muscles get weak and thin. What are the causes? Heart attack. Or when you have a viral infection, with the COVID, a lot of people were getting cardiomyopathy. And the COVID is, we are talking about that, a viral infection. Or it can be inflammation. Now, here what happens? The heart stretches out and affects the heart pumping ability. And finally, we have the restrictive cardiomyopathy, where the heart muscle becomes rigid and less elastic. It prevents the heart chambers from filling properly. When the deoxygenated blood comes over to the right side of the heart, it cannot fill the heart properly because the heart muscles are rigid. And this happens when you have a systole, it means your heart is contracting. And diastole is when your heart is relaxing. So when your heart is relaxing, the blood comes into the heart, but it does not fill properly. So what is ejection fraction? You always hear when you do a ultrasound, and people tell you, oh, your ejection fraction is so. What is ejection fraction? It's a measure of how much blood your heart is pumping. Normally, it is between 50 and 70%. 40 to 49% is borderline. 30 to 40 mild to moderate heart failure. And below 35 is severe heart failure. So now, understanding this, let's go on to the risk factors of congestive heart failure. Risk factors are anything that can cause any of these risk factors, your blood pressure, diabetes, all that can cause congestive heart failure. Being older than 65 is also a risk factor. Using tobacco products, cocaine or alcohol. We talked about alcohol, cardiomyopathy. Nicotine in tobacco products can cause blood vessel constriction, causing high blood pressure. Again, there goes your heart failure. Having an inactive, sedentary lifestyle, eating foods that have a lot of salt, cholesterol, saturated fats, having a high blood pressure, very common, having coronary artery disease, like I have, having a heart attack, and having a family history of congestive heart failure, whereby, you talked about the cardiomyopathy, it can be due to genetics. So we go on to complications. What happens when you have congestive heart failure? You can have irregular heartbeat because now your heart may beat irregularly because to keep up with the body's demands of blood. And this can feel like a fluttering or racing heart and can lead to more serious heart rhythm problems. Then you can have valve problems along with congestive heart failure. In fact, issues with the heart valves, which we talked about, can both cause the development of heart failure and can occur as a consequence of heart failure and cause the valve problems. Your kidneys and liver rely on healthy blood flow to work properly, and when the heart isn't pumping well, complications can be, it can affect the kidneys and liver, leading to damage of both these organs or even failure. Now, for those who want to know, like I, I know people in this group who have pulmonary hypertension. So this is a bit deep. So if you want to just relax in the next 1 or 2 seconds, it is okay. Okay. But increase left heart pressure, left side. The left ventricle cannot effectively pump blood out of the body. This leads to increased pressure in the left atrium and thereby in the pulmonary veins that bring oxygenated blood to the left side of the heart. This causes congestion in the lungs. The increased pressure in the pulmonary veins translates into higher pressure in the pulmonary arteries, the other side now, as blood backs up and accumulates in the lung vessels. And this is when you get pulmonary edema or fluid in your lungs. Now, chronic high pressure, back pressure in the pulmonary arteries can lead to changes in the pulmonary blood vessels, making them thicker and less flexible, which can exacerbate the problems of pulmonary hypertension. Okay, we are now going into the 4 stages of congestive heart failure. As I said in the start of my talk, that we are interested in the first 2 stages, stage A and stage B. There are 4 stages. They range from a high risk of developing heart failure, stage A, to having advanced heart failure, stage D. Stage A, people, listen to this. If you have a high risk of congestive heart failure because you have a family history of congestive heart failure, or you have one or more of these medical conditions, the chances can increase of getting heart failure. Uncontrolled hypertension, diabetes, coronary artery disease, metabolic syndrome, where your cholesterol levels are high and your good cholesterol is low, your triglycerides are high, you got visceral obesity, abdominal obesity, that can lead to heart failure. Alcohol use disorder, we talked about it, history of rheumatic fever, which is very uncommon now. We don't have see patients rheumatic fever hardly, maybe. In my time, we saw a lot. Family history of cardiomyopathy and drugs that can damage your heart muscle. This is where we concentrate on stage A. Even stage B, where you're pre-heart failure, your left ventricle isn't working well or is structurally abnormal, but you still don't have any signs and symptoms of heart failure. You see, people will come to me sometimes, and when we do an EKG, it shows left ventricular hypertrophy or left ventricle enlargement. But the patient does not have any shortness of breath, no signs and symptoms. But it is a sign for the doctors to tell the patients, be careful. Your heart is getting enlarged, your left ventricle is slightly getting enlarged. Do something. Because if you reach the stage C, then you start having congestive heart failure diagnosis is given to you, and you have signs and symptoms or previously had signs and symptoms of this condition, like we talked about shortness of breath and fatigue. And stage D is with reduced ejection fraction. And sometimes stage D, the ejection fraction goes so low, like that lady that we talked about, 16%. And then this, now we have got treatments, but this in my time was a downhill road from here. So our point in here is the stage A and stage B. Tests are done. You have blood tests which are natriuretic peptide, a kind of a protein the heart secretes to keep blood pressure stable. These levels increase in heart failure. You may be tested for anemia. That can cause worsening of heart failure. Your chest X-ray will be taken to see the shape of the heart. And if there is any fluid buildup, your electrocardiogram to determine the rate, rhythm, and size, and clues of your left ventricle being enlarged or its chambers, other chambers being enlarged. And then you have the echocardiogram. This enables your doctor to evaluate the heart's ability to pump blood, ejection fraction, and to identify any abnormalities in the size or shape of the heart. MRI is done, can help identify whether heart tissue is scarred, which occurs as a result of some cardiomyopathy. Your Mugger scan, these are particularly useful for monitoring changes in heart function over time, especially in patients undergoing chemotherapy or other treatments that may affect the heart. These are things not to your this thing, but at least you may have an understanding of why the doctor is, or ask him, why are you ordering this test? What is it for? What it'll show? You have every right to ask your medical provider. And then we go to the management part of it. Stage A, your regular exercise, no tobacco products, low salt diet, treating all the other blood pressure, cholesterol. Now, remember that the goal of treatment is what? To keep you from moving forward through the stages or to slow down the progression of your heart failure. You can go up to stage B, pre-heart failure, and then stage C, where there is restriction of sodium and weight tracking and fluid restriction and pacemakers. And finally, you go into, uh, you have to manage other conditions like anemia, blood pressure. We talked about it. Now, complication of congestive heart failure treatment may include high blood pressure, kidney failure, infections from frequent hospital visits that involve central IVs. Now, same thing over here is how you can change your lifestyle. Now, the outlook and prognosis. Now, this is taken from the studies that have been done. And one study shows that people with congestive heart failure have a lifespan of 10 years shorter than those who don't have heart failure. Another study showed that the survival rates of people with chronic heart failure were 80% to 90% for 1 year, 50 to 60% for 5 years, for year 5, and 30% for 10 years. And then again, a different study showed that people who had heart failure had expected the lifespan from 3 to 20 years after their hospital stay. Your prognosis or outlook for the future will depend on how well your heart muscle is working, what are your symptoms, how well you're prepared to change your lifestyle, how well you respond to the treatment. Okay, now we go to a very important topic. Is a heart failure exercise and activity? Regular exercise has many benefits for patients with heart failure. A regular activity program will help reduce heart disease risk factors and the chance of having future heart problems. Strengthens the heart and the cardiovascular system. It improves circulation, helps the body use oxygen better, help increase energy levels so you can do more activities without becoming tired or short of breath. Improve your muscle tone and strength, and improve your balance and joint flexibility. Now, here I want to tell you there's a very dear friend of mine. Her name is Angela Fischetti. She is here on this program and will talk to you for a few minutes about exercise and heart disease at the end of this talk. She's a remote senior fitness consultant, a remote hatha and prenatal yoga instructor, and she provides strength training and yoga videos to whole food plant-based platforms. I've seen some of the people who've been on our program and they have improved tremendously. So I will give her the platform as soon as I give you the final case study. This is a case study that you should understand of how important diet becomes. This is a plant-based diet and heart failure case study. Actual case study. There's nothing uh, fabricated in this. 76-year-old man, progressive dyspnea, progressive shortness of breath, three-vessel coronary artery disease, ejection fraction. Now, everybody knows ejection fraction, right? 35%. It means severe failure. Moderate to severe aortic regurgitation. That valve is not closing properly, that sends out the blood to the different parts of the body. He is on aspirin, again, the beta blocker, and ARBs. These are blood pressure medications and heart medications. He was advised coronary artery bypass surgery and aortic valve replacement surgery. Patient refused, chose to adopt a whole food plant-based diet. On initial presentation, his weight was 180 pounds, his blood pressure was 127/50, and heart rate was 49 beats per minute. 2 months after adopting a whole food plant-based diet, his weight fell 18 pounds to 162 pounds. There was not much change in the blood pressure and heart rate, but his cholesterol fell from 201 to 137. His triglycerides fell from 112 to 96. And low density, the bad cholesterol, from 105 to 67. And folks, these lipid changes were attained without cholesterol-lowering medications or supplements. And guess what? His exercise tolerance improved. He could walk 2 miles the measured space without shortness of breath or other complaints. He began a light aerobic exercise program and practiced yoga for 1 hour 3 times per week, in addition to beekeeping and gardening without having any symptomatic limitations. And then I would like to tell you what happened. His meds were adjusted, 2 months follow-up. On follow-up, echo 6 weeks later, his ejection fraction increased 50%, in the normal range now. Increase his exercise to moderate intensity without difficulty. His moderate to severe aortic regurgitation persisted without change because he did not want surgery. To our knowledge, this is the first report of an improvement in heart failure symptoms and left ventricular ejection fraction following adoption of a plant-based diet. And plant-based diets may improve blood pressure, glycemic control, sugar control, obesity, risk factors for heart failure. Plant-based diets may slow the progression of atherosclerosis, a risk factor for heart failure, may even reverse atherosclerosis. And let me, before Angela comes on the scene, let me tell you that this case study and previous case study were actual case studies, and therefore think about your whole idea should be, when I sum up, I'll let you know, but I think I'm going to stop sharing this screen and let Angela come in for a little bit to let you know about heart disease and exercise. So I'm going to stop share now, and I'm back with you all. Am I good?
You are good. And now we're going to get Angela to unmute her video and her audio. There she is.
Hello.
There we are.
Mm-hmm.
And so, go ahead.
Are you telling me to go ahead?
Dr.
I'm sorry.
Akil, would you like to just do another short introduction? And then Angela can take it over.
Oh, Angela is here. I already introduced her. She has made real changes in so many of the people that I come to know. And I said, how did you manage this? And they said, we have been for Angela's group sessions and whatnot. So Angela, take it away.
Thank you so much. It's such an honor to be here with the both of you, with all of you, quite frankly. So you covered it. You really covered the benefits of exercise as it pertains to heart. If somebody has heart disease, what I wanted to do here was just to relay a little bit of how I kind of learned more about what people go through with heart disease. And I have worked with many people over the decades who have had heart disease, but there was one individual in particular who stuck out. And I would like to just talk a little bit about the journey with him, because I think so many people misread the symptoms of heart disease. They don't catch some of the symptoms. And I really went from thinking this person may have been a hypochondriac to, wow, this is heart disease. This is not to be confused. So, you've done a brilliant job in past presentations also, doctor, with talking about the benefits of exercise, but not only to prevent heart disease, but what you can do when you have it, and then also reversing it. So I'm calling this Cy and I. His name was Cy, and I had his permission to use his name in social media, first name. So we date back to 2002, and we met through our mutual yoga instructor. I had just gotten my my certification as a hatha yoga instructor, and he at the time had expressed to her that he was interested in having a trainer. So we got introduced, and we began our work, and I was like, wow, he can't really handle much, and it's a lot of ooh, ah. And I just didn't want to hurt him. I was very concerned of hurting him. And so we only worked maybe 5 or 6 months together. So that was it. We parted ways professionally. However, we maintained a rapport for the next couple of decades, because you see, I am from Brooklyn and he was from Queens, and we both loved the New York Yankees. And that's why we maintained this association, and also with his wife. Well, from a professional perspective, we reconnected in 2018, and he approached me at Whole Foods and said to me, well, this must be serendipitous. as I need a personal trainer. So, my mind flashed back to when I was kind of judgmental, thinking he was hypochondriacal and all that. And I said, okay, let's give it a try. This is the Cy that I encountered in 2018. I actually have to read this for you, that his issues were that he had peripheral arterial disease, PAD. He had hypertension. He had high cholesterol. He had metabolic syndrome. This is beginning to sound very familiar based on what you were just listing. And what I noticed about him, and I noticed this a lot about people with any conditions, they get attached to them, and they start referring to them as my hypertension, my high cholesterol, my heart disease. And it kind of lends itself to maybe not so fully being prepared to possibly change that outcome. And he had already called himself a diabetic when he was not yet there. But that was the situation. He had many orthopedic concerns. I will spare you, but there were a minimum of 6 or 7. There were neurological issues as well. These are major things. And so you can imagine, with trying to put together an exercise protocol for him, I had to contact many, many specialists, and he was on approximately 16 medications. And we worked for a little bit, and he was excellent about doing his walking. His cardiologist really stressed for the PAD to make sure he gets in walks, and he was really great about it. But the thing is, he was really weak, muscularly weak. And I thought, well, how's he going to help his heart if he can't just do basic functions like push something, what have you? So I introduced the concept to him of strength training, and he went with me on it. He did. And I was so pleased about that. I mean, he was 5'3", and he played basketball with the tall guys out in the streets of Queens. I kind of thought he might have had a little oomph in him. And I was right, because amongst his many medications, there were medications for depression. And I later learned that depression can be a symptom of heart disease, but it's not really recognized quite often. Now, for me, that resonated because I was on psychotropic drugs for 25 to 28 years. And what I did was got off of them, and I went to weightlifting. And what I did then was, I said, I want to try this with him. Well, Cy, who was depressed, became, as he gained more and more confidence through weightlifting. And I'm not talking heavy weights. I think the heaviest I had him with was 8 or 10. But this was amazing for him because he had absolutely no confidence in himself when it came to physical strength and inner strength. And over the course of the time that we were together, he was doing push-ups, but real push-ups, and he felt so great about himself. And his personality started to morph into somebody really funny. And he was kind of impish. We were working during the pandemic. And first, of course, before the pandemic, we were meeting in person. And then we were working virtually. Well, there were times I would catch him, doctor, he would be like sneaking off camera. And I'd be like, dude, where you going? And he would come back in camera and go, I want to see the score for the Yankees. Don't tell my wife. And I would say to him, get the score and come back to me. I want to know. So it was that kind of, I saw this man blossom into somebody who was more confident. He shared with me that he never felt that he could have any physical strength because he lived his life thinking he would absolutely die the way his father died, genetics with having heart disease. However, his father passed in his 50s, and at this point, Cy was 70. And I'm going to say that, you know, he did the best he could, but it was a lifetime of poor diet. However, he watched me in my lifestyle choices. I had a bad bout in 2019. I had some health challenges. I decided to go on a 10-day water fast with Dr. Frank Sabatino, and it's a 16-day event. So I watched this, and he was very curious about how I eat. And he and his wife were living in a facility. So she had Parkinson's, and at this point they were in independent facility. But they ate there, which means lots of salt. I couldn't get him away from the salt. And he thought it was great that he was having fish every day. He would tell me about salads. He would tell me about fruit cocktail that I think might have been out of a can, you know. But he did get to the point with his wife where they went grocery shopping, called me from Publix, and talked to me about beans. He was in the beans aisle and she was in the greens aisle. And they incorporated more plant foods. And he was getting a really good response to this. It's just that it was so many years of abuse to the body. And one day in October of 2022, I received a phone call from his wife that Cy passed away in his sleep. I was so touched by what she said, because she said he was just really happy at the end of his life. And he had insomnia. That's another sign. He had insomnia and he was able to sleep better. It's just that we couldn't get to him early enough because he was being put through the medical mill with stents and the cardiac catheterizations that you were talking about. So every time he made a little step forward, it was the steps back with that. But I witnessed somebody profoundly change by the process of strength training, incorporating more plant foods. And I just want to emphasize to people, one of the reasons why I wanted to mention Cy is because of a study I found on the NIH database. And and if you folks want me to send you the link to it, I'm happy to do so. It's a fascinating study. It's called The Effects of Resistance Training on Depression and Cardiovascular Disease Risk in Black Men. Protocol for a randomized controlled trial. And it was published in Mental Health and Physical Activity Journal, September 12th, 2019. You can also go to, let's say, Harvard Health Publishing, and there are many, many articles here about heart disease and strength training. So I want to just emphasize that if you want to help your heart, build your other muscles too, the strength of them as well, because it will be a massive help to your heart that it doesn't have to do everything and try to do everything. So that's really what I wanted to emphasize today. Remember that you have aerobic work, which of course is excellent. And, you know, that means with oxygen. Strength training is anaerobic without oxygen. And with anaerobic, you require short, sudden bursts of energy. And so that's what I wanted to share with you today, Doctor, and everybody, that my tale of Cy and I.
Thank you so much, Angela. That was
Thank you.
very heartwarming. And you managed to give him a few quality years, and that is
Yeah.
because generally speaking, our lifespans have increased, but our health spans have decreased. And somehow the last 20 years of our lives are often miserable.
Mm.
And number one. And number two is that was very, very thoughtful and provoking and insightful. So thank you
Thank
very
you.
much. I
Thank you
want
very much.
I want to also talk about salt. We Americans take about 3.5 grams of salt a day, when the American Heart Association says 2.5 grams. And I personally believe it should be 1 to 1.5 grams. Now, having said that, if I may, Karen is over here, Karen Keene, and she says that because and she's doing this because of her mother-in-law who is in stage 3. Karen, tell her not to lose hope at all. She's going to do great. Let her follow a whole food plant-based diet and cut down on salt or no salt, and she's going to do superb. And finally, I want to tell you this. This was an observational study done by Dr. Dean Ornish. What they found was they took 30 patients who were severely in congestive heart failure, when their ejection fractions were way down in 12 and 10 and 9, and they were all waiting for a heart transplant. Now, what they did was they put all these patients on a whole food plant-based SOS diet, no salt, oil, or sugar. And guess what happened? All 30 of them improved the quality of their lives just by a plant-based diet. And 5 of these people did not need surgery. But that is the power of a whole food plant-based diet. With that, I thank you very much, and I'm open to questions or comments or whatever.
So if you'd like to turn your camera on and come back on screen, we'd love to see you and to hear your questions. If you'd like to just put your questions in the chat, that will work as well. We will be sure to ask your questions. Anyone, I didn't see anything getting added, but I do know that I had a couple of questions come in. Let me go and grab those really quickly. So Dr. Akil, tell us if you have had the opportunity to see a patient with congestive heart failure. You know, a lot of times it's difficult for a doctor to relay this information because when people first hear it, it automatically takes you to, you know, is this a death sentence for me? How have you been able to convey that information to a patient? How have they received it? And what have you advised them to do?
You see, the point is this: the moment they come along with a high blood pressure and having an anatomy difference in the left ventricle, then I know for a fact that eventually this person may go into heart failure. That is the first stop, is to get the blood pressure under control, get the cholesterol under control, get the sugars under control, get the weight under control. All these factors, risk factors, should be controlled. I see most of the patients at this level, stage 1 or stage 2, where they have an enlargement of the heart, but still they have an enlargement, but still they don't have the symptoms of heart failure, shortness of breath, and that will come. It'll come very soon. But these are the people that we catch. Now, having said that, there are certain people who come to us from the cardiologist for other issues to us, and we find them there in stage 3 or late stage 3 or stage 4, when there are a lot of new medications that have come out. They use medications, they are there, and the heart doctors look after that. Irrespective of what stage you are, like I told you about the Dr. Dean Ornish's study, you can go on a whole food plant-based diet and you can come out, at least your quality of life will definitely improve. So we see a wide range of patients, but generally speaking, when we see in a chest X-ray enlargement of the heart, and then we say, "Oh, wow! Now we've got to do other things. Let's get an echo," or we get somebody coming with edema of the legs and saying, "I'm a little short of breath," and when we do an echo, ejection fraction is low. So but my point is very much, let's prevent it. If you have a cardiomyopathy which is there in the family, and that's a different issue. Or when you got COVID and I saw people having cardiomyopathy, that is a different issue. You're still going to control it. You're still going to be there. But what can be done by just change your lifestyle, which I don't understand. So that's the problem. Now, I had a coronary artery disease. I had a heart bypass surgery, but I was lucky that my heart muscles were not damaged.
Mhm.
So
Mhm.
people do get a heart coronary artery disease and get a heart attack and have the muscles damaged. And they are now in stage 1, stage 2, or stage 3, not stage 1, stage 2 or stage 3. And that is when we have to talk to them and get them on.
Mhm. And that's what Karen is saying. Her mother-in-law is in stage 3 at age 85. And she spends a lot of time in bed watching TV. And they try to get her moving as much as possible, but her legs and her toes are currently throbbing, and she's 120 pounds. She's got COPD and high blood pressure meds and uses oxygen intermittently. Um, would you consider that as kind of a last stage or near last stage?
Quality of life can be improved. I still feel that Angela should do one of these talks whereby people can exercise in bed.
Mm-hmm.
That's a very important thing. There's so many things you can do just in bed, slowly, with the help of someone. But that is something that I would like Angela to talk about one of these days, or even now, if she has got a point to make. But to me, I believe that irrespective of what stage you have, try as far as possible to exercise in some form or manner, however little it may be. It does wonders.
Mm-hmm. Totally agree. And Angela says, yes, sounds wonderful. But a question did come in about what preventative measures you might recommend. Well, we know that you're big on exercise. We hear you talking about the eating, the whole food plant-based eating, no SOS or SOS free. And besides that, what are some of the other things that you recommend as a preventive measure to prevent
Yeah,
CHF?
I given a talk to in monthly talks. One of my monthly talk was on the 6 pillars of lifestyle medicine. And I've always maintained that, and I will not go back on that. I've always maintained that the cornerstone of the 6 pillars is your diet. And the rest of them are complementary to the diet. So when you have a whole food plant-based, no oil diet, or very little oil or sugar or salt diet, or plant-based diet, that becomes the person, the uh, maestro to this whole uh, gamut of the 6 pillars of lifestyle medicine. Apart from being the cornerstone, your diet, the rest of them are complementary. Your exercise, your sleep, your handling of stress, having a good social support, and avoiding substances that are going to harm you, and addictive substances Maybe it is medications prescribed or otherwise over the counter, alcohol, smoking, and processed foods. These are all the six pillars that I bank on. And I've always maintained that a lot of people say, but I eat right and I exercise, but I have a lot of stress and I can't go to sleep. Yeah, it is good in a way that you're exercising, but the maximum health outcome can come if you follow all these six pillars, then you get the maximum health outcome. We all have problems with one or two of these pillars. My problem is sleep, and I'm trying to work on that. Some people may have a problem of exercise. Some people diet. Diet is the most, the baton in his hand is a conductor. So to me, the six pillars, if you manage to do that, sleep your 7 to 9 hours a day, do your exercise like Angela talked about it, which could be muscle strengthening exercises, aerobic exercises, balance exercises, and all these, the exercise part of it, the stress part of it. If you get a chronic stress where your cortisol levels go up high and constantly, then you will become addicted to eating, and then and I always tell people this: your stress levels are due to the 4 Ds. It is due to your diet, which may be this thing. It is also due to if you have got a divorce, and if you, there's Vidya Patel. Okay, so we have is what you have is your diet, your divorce, your debt. If you're very much in debt, that can cause you to have, and I'm sorry, it's not the diet, it is the divorce, the debt, the death itself can cause you to have this. So these are the problems that people face. How to handle? You can handle the stress by going to crutches like meditation, yoga, breathing exercises, sky breathing, psychotherapy, exercise. So you can deal with this. And so if you deal with all these problems, the six pillars of lifestyle medicine, you are game, you're in good shape.
Awesome. What a great explanation of the six pillars and the fact that they are such a great supportive system for overall health, heart health, and everything else.
I
And
would like to just correct myself. The 4 Ds that I was talking about, it just slipped my mind. It is debt, which you have a lot of debts to credit card companies, banks, or whatever. Divorce is number 2D. Number 3 is disease. And number 4 is debt. These are the 4 Ds.
great. Thank you. I've put those in the chat so that people can see it and remember it. And as we're wrapping up, Dr. Akil, is there anything else that you would like to share with our audience today?
Uh, I will not be doing a monthly talk next month, as I'm going to do a talk in London next month. And then after that, I'll be going over to, I guess it is Hilton Island. Yeah.
Yes,
So
Hilton Head.
I will not be able to do that the next month talk, but hopefully we'll meet again in May.
In May. We'll meet again in May. So in April, April is going to be our opportunity to share some of the videos that Dr. Akil has already done. So check in our Facebook group. We'll be sharing little bits of some of the videos and the link to the full video so that we can get this message out there, and we can use the month of April in order to do that sharing. We're going to call it Spring into Wellness. And we're just going to share some of the great information that Dr. Akil has already brought to us. share it with our friends, and just send it by email, send it on social media. And sending it, that's all you need to do. And that's all we'd love for you to do. So with that being said, thanks everybody for joining us today. This has been really great. We all are more well-versed in what congestive heart failure is, how to prevent it, how to reverse it, and how to live our healthiest lives. So the Facebook group is, let me just grab the link really quickly. It is Dr. Akil's speaker Facebook page. Here we go. It's Akil Taher, author, MD, author and heart healthy speaker. And here is the link. And thank you everybody for joining us. This has been really great. Have a
One last thing, I've read all your comments, so I'm aware of it. So thank you very much for those comments.
And since we won't see Dr. Akil until May, unless you find him on social media doing all of these speaking opportunities everywhere, let's wish him a happy, happy birthday. He's going to have a birthday next week, and he will be 76 years old, young, 76 years young, and just a shining example of what each of us can do as we're on our journey of living our best lives. So happy birthday.
Thank you. Thank you so much. So much. 76, yes, getting there. But thank you, everybody. Love you all. Love you all.
Thanks, everyone, and we will see you live. You'll get the emails about the May event. And in the meantime, we'll be sharing a couple of emails about what's going on in Facebook with sharing some of the videos. Okay? Thanks, everybody. Have a great rest of the month and a happy April, happy Easter, and all that good stuff. And we will see you again soon.